I think we've talked a lot about the new implementation. Why don't I let you transition now to whether or not this is an integration rather than a new implementation?
When you're looking at optimize your technology, you want to look at a couple different options. One option is to do the implementation. Is it a brand new system, or do you want to take an integration to your current technology that you have available? For starters, you want to look at maybe identify what's the difference between the two. An integration would be is defined as an act or instance of combining into an integral whole, versus an implementation would be the act of implementing a whole new process, say replacing your ERP as a whole. With the integration, maybe you want to bring on a third-party vendor to really satisfy that niche, that missing gap that's going to help you be successful. Some of the pros with being an integration is it could be less costly, less training, less resources that are necessary. But some of the cons one of the biggest cons that kind of come with it is it could create a little bit more complexity within your technology system. You may have one more maintenance program, one more integration piece that could go wrong. So you really want to evaluate what's going to be important and how is it going to impact your day-to-day operations. Right. With the implementation, one of the pros is it really can, as we talked, we can really address all those different gaps with one solution. One of the cons with the implementation could relate to how expensive and how many resources are going to be to take. Because one thing to do is to replace the ERP, as you said, there's so much extra work with the item master cleansing and all the other pieces with it, you're going to need additional resources. It's just a major, major task, and there's really no way around it.
Do you find often what I think is it's misconstrued is people think, well, we're just integrating software into our everyday practices, that's going to be an easier transition, when really sometimes adjusting from business as usual to the new business process is probably more challenging in a lot of ways. I know there's pros and cons in both, but I think people are kind of set in using their technology the way it is, and when you're trying to integrate it a little bit differently, sometimes you get stuck.
Yeah, that's a good point. One of the things to consider when you're looking at integration for implementation is how is it going to impact your current data, your item master, as we said, but how is it going to integrate your historical files? A lot of times with a third party that fills that niche, it's not going to impact that. It's just going to enhance your ability to do more things, maybe more efficiently. With the implementation, you want to take a look at, do we have to modify our item master? Is it going to retain our historical data that's going to allow us to continue to make analysis and to help us make the decisions we need to make to help our organization be successful?
Well, that was a great transition to me wanting to talk about the databases now and how they'll impact your supply chain and your revenue cycle. I'm going to start with outlining what databases we usually encounter. Now, there's a lot of databases within a typical healthcare organization, but for our purposes today, we're going to talk about your item master, your IM as we like to refer to it, your charge description master, the CDM. I always include the pharmacy data master when I'm discussing this, because if we're looking at total cost of care, that starts to become involved. But that's really a little bit out of scope for today's discussion, so I won't get too heavily involved in that. And then I usually refer to our financial data master or the service master, depending on what organization I'm in. Sometimes these are separated into two parts. So let me talk a little bit about how these will affect. You know as well as I do, the item master, that's the material management, like central supply repository. If we're going to bring an item into the hospital, it has to be in our item master. If we want to charge for it, on the other hand, it needs to be in our charge master. Right. So that's where I kind of talk about the synchronization component and how supply chain really needs to be aware of the charge description master, where years past it wasn't really in their wheelhouse.
But on top of that, how do you get those two to talk to each other and be up to date?
That's a good question.
With all the factors with it.
So let's talk a little bit about the charge master and why that's so important to supply chain. Most often, supply chain doesn't realize that we need that data that's residing in their item master. It needs to be included in their charge master to make the bill go out effectively, to make the charges be accurate and complete. And so we do have to look at our hospital services, whether it be our drugs or supplies, making sure that anything that we're currently housing in our item master, that information, as far as like your item master number, your unit of measure, your packaging string, that we do get that into the hands of the charge description people so that they can make sure that we get our bills out correctly. And I know from a financial aspect, more often than not, people think, well, we got it into our charge master, it's in our item master, we're good to go. Well, often those two don't necessarily do the billing. So it has to flow accurately, completely into your financial system. The financial system at the end of the day is traditionally the one that handles all the relevant information for billing and charging. And we wouldn't be able to keep the doors open if we didn't get that out correctly, no matter how good our item master file looks. So let's talk a little bit about that synchronization while we're on that topic. And we'll start with what's in scope. When you start your technology implementation, you need to know, are we doing that item master cleanup, that CDM cleanup? Are our financial databases going to be affected? And at what point do we need to synchronize? I did just talk a little bit about the descriptions, about the item master numbers, the pricing. I feel that they're crucial to a successful implementation or even an integration. Because sometimes you need to change your data. All right, great. Well, let's talk about that add, change, delete process.
Sure.
I know that's some place where most people feel that there's a breakdown or there could be some difficulties. We all have a form. I would encourage you, since we're focused on our technology today, that if we can automate it, let's automate that process.
Exactly.
The less people touching, the better. The process tends to flow a little bit more smoothly when we have it in an electronic workflow. One other thing I would encourage is the policies and procedures. If we're going to put a new documentation or a new policy in place when we're doing this for our transition.
And that's an important piece too. And when you're kind of doing, no matter what kind of integration implementation you have, you want to take a look at your current processes and policies and really understand, how is this going to impact that? Or do we need to create additional ones too that are going to adjust for new processes and how the data is collected and how the data is used and how the data is going to be synchronized with the other systems.
You did bring up a really good point there, Chris, about making sure that, especially if it's an integration, people think that the existing policies are in effect, so there's no need to look at those. But you really do need to review them and make the necessary updates and changes.
Exactly.
And one thing I do stress, too, as well, is that we have all different types of learners out there. I often find that you need to document it in different ways, whether you're doing your policy and procedure in a written form. Maybe you should get a Visio document out there, because some of our clinicians are more visual. Some of our administrators, who need to read that will focus better. And they often find changes, that they didn't think were necessary at the start. And I'm sure you're going to talk about that in the training and education section.
That will come up.
One other thing I like to recommend when we're talking about the synchronization is, once you put the processes in place, you've done the cleansing, and you have your add, change, delete form automated, that you want to make sure that you have audits. There's nothing worse than putting a process in place and nobody's checking to make sure it's effective.
Yep, and a lot of your technology should provide that ability within it. If the policy is not in place, then at one point you really got to divide your operations and your processes around that to make sure you address all the different points that the process touches.
Right, and absolutely. I think that you kind of touched on an important topic there too, is making sure that the stakeholders that need to be informed or consulted have an idea of what's going on, because often we feel like we're in a supply chain realm. So we don't need to reach out to our revenue integrity folks or our value analysis folks. But in this type of implementation, when you're getting into that level of detail, you have a lot of important players. We have our IT folks, our finance, our value analysis. They started.
And all those players should be identified at the beginning of the process.
Correct.
And really kind of be part of that initiation kickoff meeting.
And I like to always say that when we're dealing with the stakeholders and we've identified the players, that we want to give them an opportunity to discuss any concerns or issues, a forum where they can go, or some type of process to document what these concerns are. And with that, I'd like to then transition back over to Chris. Chris is going to talk a little bit about our vendor solutions and some training and education.